You said something that really struck me, and that was extend the life of the disease. And that's such a challenge to hear. I know we're all on the same side. We're wanting to extend the life of the remission if something is chronic and happening. What have you heard from patients about what they do in situations where they perhaps have heard of a treatment, they can't get it where they are, what actions they can take or how they connect with a patient group that is working in this area and helping to educate around the quality of life, the challenges of living with this, the importance of being able to have different treatment options. What are your thoughts?
I think it's important to have some form of support group when it comes to a chronic condition because it normalizes the condition a little bit, knowing that other people have it. So it creates a bit of a sense of community. You do have to be a little careful because some people will say, "Oh, I tried this," or "Oh, I tried that." So that's sort of the N of one kind of sample size of this worked for me doesn't necessarily work for everyone. But that still doesn't change the fact that having a community around this is quite helpful and essential. Obviously, sometimes patients come in expecting a certain type of treatment. I haven't necessarily gotten this very much with chronic hand eczema. I get it a lot with eczema and psoriasis of the body, more so than chronic hand eczema, which they saw an ad on TV or like their friend is using it or whatnot. And they ask me about the treatment and I tell them, well, there's certain criteria that we have to pass to get to that for there to be coverage. And so people do have to pass through hoops. But I'll turn the question around a little bit and bring up a notion that's been brought up more and more in the literature called cumulative life course impairment. And so this is something that exists, especially when it comes to eczema or atopic dermatitis and psoriasis, and obviously more so for younger patients than older, but still for older patients. The basis of this is that the longer you have a specific disease, the more likely that disease is to affect you in various ways, which will then affect your life decisions and life course, and that will compound over time. So it's a little bit of an easier thing to see in a child, for example, where you might have very bad eczema that prevents them from concentrating in school or sleeping. And so then they develop at a potentially slower rate, and then they increase the risk of getting anxiety over time or concentration difficulties, difficulties in school, and that can lead to fewer social connections and development and progression throughout life and achievements and grades. And so that has this cumulative impairment. Same thing for adults when it comes to work. If you have a skin condition that affects your work, you're missing work, you're less likely to get promoted, you're less likely to have social relationships, romantic relationships, etc. Like all these things accumulate, more likely to get depressed, more likely to get anxious. So when you have a condition, all this to say that when you have a condition that lasts longer, all you're doing is accumulating these dings on yourself.